A transient ischemic attack, TI, commonly referred to as a mini-stroke, is often dismissed as a minor incident, but emerging research reveals a far more unsettling truth. These seemingly fleeting episodes may leave lasting damage on the brain, significantly increasing the risk of cognitive decline and dementia. Many individuals who experience a TIA fail to seek medical attention, either because the symptoms resolve quickly or because they are unaware of the potential consequences. This widespread neglect of early warning signs could have catastrophic long-term effects, contributing to the rising number of dementia cases worldwide. Researchers from the University of Alabama have uncovered alarming evidence that even a single TIA can set off a chain reaction of neurological damage, leading to cognitive impairment later in life. Their findings, published in JAMA, indicate that mini-strokes are not just precursors to full-blown strokes, but are independent risk factors for neurodegenerative diseases. Even when accounting for traditional vascular and demographic risk factors, the link between TIAs and cognitive decline remains strong. The implications are dire. Millions of people could be unknowingly accelerating their path toward dementia simply by ignoring what seems like a minor health event. The study followed over 350 individuals who had suffered a first-time TIA and compared their cognitive decline over 14 years with nearly 1,000 stroke patients and more than 14,000 healthy individuals. The results suggest that up to 20% of TIA patients develop dementia later in life. These numbers cannot be ignored, yet many people continue to dismiss TIAs as harmless episodes. Professor Peter Berlit, General Secretary of the German Society for Neurology, emphasizes that this research aligns with previous systematic reviews and should serve as a wake-up call. The reality is stark. TIAs are not isolated incidents, but significant contributors to the growing dementia epidemic. One of the greatest dangers of TIAs is how often they go undiagnosed. Many individuals fail to recognize the symptoms, which can include sudden headaches, blurred vision, dizziness, speech difficulties, and temporary paralysis on one side of the body. Because these effects may last only a few minutes and then disappear, people assume they are harmless. However, the fact that symptoms subside does not mean no damage has occurred. Every TIA represents an interruption of blood flow to the brain, and each incident increases the risk of a major stroke in the following days. According to stroke specialist Professor Jürgen Bardutzky, 10% of TIA patients suffer a full stroke within a week of the initial episode. Those who delay medical intervention may be gambling with their lives. Despite the severity of these findings, awareness remains dangerously low. Many people do not seek treatment, missing the opportunity for preventative medication such as blood thinners, cholesterol-lowering drugs, or antihypertensives that could drastically reduce the likelihood of future strokes and cognitive decline. Even more concerning is the lack of education surrounding stroke symptoms among younger populations. While strokes and TIAs are often perceived as conditions affecting only the elderly, they can occur at any age. Failing to recognize early warning signs could mean the difference between timely intervention and irreversible brain damage. The growing number of TI-related dementia cases highlights a broader failure in public health awareness. As the global population ages, neurodegenerative diseases are set to skyrocket, placing immense strain on healthcare systems. If mini-strokes continue to be dismissed or overlooked, the burden of dementia will only worsen. It is critical to implement widespread educational campaigns to ensure that people understand the significance of a TIA and seek immediate medical care. The message must be clear. There is no such thing as a harmless stroke. Every episode, no matter how brief, could be a warning sign of a much more severe event to come. The evidence is overwhelming, yet the response remains insufficient. Individuals must take symptoms seriously. Healthcare systems must prioritize early intervention, and researchers must continue to investigate ways to mitigate long-term damage. Without decisive action, the consequences will be dire. The silent progression of cognitive decline begins long before a formal dementia diagnosis is made, and for many, it may have started with an unnoticed mini-stroke. The time to act is now, before the damage becomes irreversible.